taken the alprazolam instead of metronidazole. He has no uses of NSAID for his treatment, his stomach infections. Elspan. Elspan is loratadine, Elspine is hyoscine butyl bromide. Levozin, levocetirizine and levozin iron. Doctor have written the levozin to the pregnant women, and if the pharmacist dispenses the levozin instead of levozin, that is levocetirizine, that is harmful to the patient also. Tozar and Tazar. Tozar is losartan. Tazar is piperacillin tazobactam. So there is the list of drugs that is given for example of LASA drugs. Epitab phenonyl, Epidan phenobarbital, Ciftab ciproxin, Ciftas cifexin. So there is a different doses also occur if the drug is given to the patient with the similar brand names and generic names differ and dose is higher. What is tormenlatine? So it is an error prevention strategy used as part of a multiple fated approaches to reduce the risk of look-alike and sound-alike medicine, name confusion and error. It is a typographic technique that uses selective capitalizations to help make similar looking medicines name easier to differentiate. Its purpose is to help select or supply the right medicine. So tormenlatine in US FDA encourages manufacturers to use tormenlatine labels to visualize, differentiate their drugs name and number of hospitals, clinic and healthcare system use tormenlatine. Example, Betalog versus Betanol. In tormenlatine, log is written in capital letters instead of beta. Codopa, cardopa, Emigra, adigra, dobutamine, dopamine, vinblastine, vincristine. These are the few examples for tormenlatine. So, in US FDA, they have mentioned some drugs and these are used in USA. That is alprazolam, lorazepam, buprenorphine, clomipramine. These are the few examples that is used in tormenlatine. How does it work? Tormenlatine combines lower and uppercase letters to highlight the difference between look-like and sound-like medicines name, like fluoxetine and fluvoxamine, making them easier for the eye to distinguish for the pharmacist whenever he dispenses the drugs, and he can easily distinguish these two drugs. What could tormenlatine be used on? One is electronic drop-down medicine list, automated dispensing, cabinet screening, smart pumps, computer-generated pharmacy labels and medicine shelf labels, pre-printed order sheet. On the closing note, it is very important that we circulate the list of confusing brand name among the practicing doctor, pharmacist and also to the drug manufacturers. Preventing confusion between already marketed product typically involves collecting voluntary reports of name involved in confusion, errors, posting warning and alerts both electronically and in area where drugs are used. The fear of malpractice lawsuits and public embarrassment has made the physician and nurse reluctant to report medications error. It is more important to create the open environment that encourages the reporting of error than to develop less meaningful comparative error rate. One possible approach to improving medical error reporting involves the uses of anonymous standardized reporting system. This type of system should also enable internal tracking, trending, and comparatives analysis. We need to have such system in India. Thank you.